Let's talk about 6 medicines that are known to damage nerves or cause neuropathy. You might feel pain, tingling, numbness, or weakness. Sometimes you feel nothing at all. It can happen in your hands, feet, or other places. This problem is more common than you think. Number 1. Drugs for fighting infections can also damage nerves. One group is called antibiotics. Some, like Metronidazole and Nitrofurantoin, can hurt your nerves after several months. People may feel burning, weakness, or lose feeling in their hands or feet. The risk goes up if you use the drugs for a long time. People who drink too much alcohol and take certain medicines are at even higher risk for nerve damage. Alcohol harms nerves by itself, and some medicines make this worse. How do you know if a medicine is hurting your nerves? Look for signs like tingling in your hands or feet, burning pain, muscle weakness, numbness. Some people feel sharp or stabbing pain. Others may trip easily or drop things because their hands and feet don't work well. Number 2. Some medicines for heart rhythm, like amiodarone, can damage nerves too. They work to slow or control your heartbeat, but sometimes cause numbness, tingling, or weakness. Number 3. Some cancer medicines work against cancer, but can harm nerves. These include drugs like vincristine, cisplatin, and paclitaxel. They help control cancer, but they can damage nerves over time. This can give you numb hands, tingling in your feet, or pain that does not go away. Research shows up to 40 people out of 100 who use these drugs for a long time get neuropathy. Number 4. Medicines used for treating fits or seizures are called anti-epileptics. They work well for seizures, but can give some people nerve problems. Drugs like phenytoin or carbamazepine may give burning, pain, or tingling in your feet and hands. This can happen after many years of use. Number 5. Some blood pressure medicines, called beta blockers, can harm nerves, but it is not very common. Number 6. Certain medicines for HIV can cause neuropathy. Drugs like didanosine, stavudin, and zidovudin work to control HIV, but may hurt nerves, especially at high doses or if used for a long time. Research says 10 out of 100 people using these drugs feel nerve pain or numbness after a few months. Number 5. Drugs for lowering cholesterol sometimes hurt nerves. Statins like simvastatin, atorvastatin, and pravastatin work to lower cholesterol, but can sometimes cause weakness or numbness. Number 6. Medicines used for fighting tuberculosis can hurt nerves too. Isoniazid is a common one. It works well against TB, but can lower vitamin B6 in the body, and that harms nerves. Some doctors give extra vitamin B6 to reduce nerve harm. Number 7. Some medicines for high blood sugar, called diabetes drugs, can rarely cause nerve damage. One of these is metformin. It works to lower blood sugar, but sometimes blocks B12. And low B12 leads to nerve pain or weakness, but this is very rare. If you have these symptoms, talk to your doctor. The doctor may change your medicine or lower the dose. Sometimes, stopping the medicine can help nerves recover, but some damage may last a long time. In some cases, it never fully goes away. Not every person will get neuropathy. Some people are more at risk, such as older adults, people with diabetes, people with kidney or liver problems, people who use medicines for a long time, people who already have nerve pain. The higher the dose and the longer you use the medicine, the greater the risk. Research says up to 50 people out of 100 using certain cancer drugs for months get neuropathy. But for other drugs, the risk might only be around 1 out of 100. What can you do to lower your nerve risk? Always tell your doctor about any nerve symptoms. Ask if there are medicine options with fewer nerve side effects. Eat healthy food rich in vitamins, especially B vitamins. Keep a close watch on your blood sugar if you have diabetes. Try to avoid alcohol because it worsens nerve harm. Let your doctor know about all medicines you take. Some medicines can work together to harm your nerves even more. If your doctor says you need to keep using a medicine that hurts nerves, ask about ways to help your nerves. Sometimes vitamins like B6 or B12 can help, but only use vitamins if the doctor agrees. Research says if nerve harm is caught early, stopping the medicine can help your nerves heal. But waiting too long can mean the damage may not get better. Some medicines are lifesavers, like cancer drugs or HIV drugs. The doctor may have to balance risks and benefits. The doctor makes sure to use the lowest safe dose for the shortest time. Always follow your doctor's advice about medicine. Do not stop taking prescribed drugs unless the doctor says it is safe. But always tell the doctor about any new numbness, tingling, or pain. Sometimes, nerve damage from medicine gets missed. Keep track of how your body feels and talk about it at every visit. Medicines serve many good purposes, but they can cause side effects, like neuropathy. Knowing the signs, being honest with your doctor, and catching problems early can help keep your nerves working for many years. Research keeps finding new, safer medicines with fewer side effects. But some old medicines are still needed. Always be alert to changes in how your body feels. If you take medicines that can harm nerves for a long time, get regular checkups. Simple tests can spot neuropathy early. Catching it early is the best way to keep your nerves safe. Remember, most people do not get neuropathy from these medicines, but being aware of the risks and taking action quickly can make a difference. If you notice trouble with your hands, feet, or balance, talk to your doctor right away. It may be the medicine, and a simple change can sometimes save your nerves. Stay safe and trust your doctor. Medicines work best when you know their risks and watch for changes in your body. Please click the like button and subscribe if you think this video is useful. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments and description sections. See you in the next video.